But what good is $1 million in your 401k if you don't make it to when you can take it out?
Yeah.
Right? Yeah, maybe your family gets it, and that's great.
Yeah.
But what about your Social Security? You got all this Social Security that you can't use, and guess what? Because Social Security is also a scam. And when you pass away, your heirs don't get it. The government gets to keep all the money you gave them. Thank you for your donation. So if you want to stick it to the government, federal, make sure you live past 65, so they have to pay out your Social Security. And now they're going to get mad at me because I'm going to make Social Security insolvent because people are going to live to 90 now. I apologize for that, CIA. Anyway.
Hey, I'm Jessica Goins, owner of OptimLife Health, and this is my husband Bradley, and together we own Goins Strong Fitness in Dallas and Cherville, North Carolina. And today we're going to talk about investments. Just kidding, we're talking about investing in your health, but it's still investment.
It's an investment. It's the most important investment.
So yeah, I'll let you start as usual.
Okay, so we want to talk about investing in your health, because everybody puts money in their 401k, they save money with no foresight on like making sure they actually live long enough to utilize that money, right? Yeah. Right? That money that you get from your retirement account at 65 don't do you any good if you died at 64 and a half from a heart attack. That's kind of like my point. So you have to think of your health as a long-term investment, and that's what we're going to talk about. And that's what you do for a living at OptimLife Health.
Yes, I do that.
So you want, I don't know, you got any insights you want to start with?
Well, I mean, I don't know, there's like so many different ways I could go with it. So what do you want me to focus on specifically?
Well, I think what's different with OptimLife Health, and I think this is something that we've cared about for a long time, even when we opened the gym 8 years ago and even before that. Many people, I think, recognize that the insurance-based medical system is not preventative. It's not truly preventative. It's not really an investment. It's reactive.
Yeah.
It's good at reactive. It's good if you get sick.
They'll save your life.
And they'll save your life. It's not good at preventing you from getting sick and addressing long-term ailments.
Well, I'll just say this. We do get a lot of phone calls, and people ask us why we don't accept insurance. And the reason is because if I accept insurance, I'm going to be limited to what they're going to allow me to do, which isn't much. So that's going to be limited blood work and limited treatments, honestly. And you can use insurance to an extent with lab work, but it's honestly really a hassle. Usually it's more beneficial to just go ahead and pay the lab costs. So
I was going to say it's a scam.
Yeah, if you're going to a place who will get your labs done for you at a reasonable price, they're using a smaller lab company and they're not extorting you, and they're not making money off the labs, then you can get it done at fairly reasonable. Full panel, everything should not cost, more than $450. And people think, whoa.
Definitely under $500.
And that's not a lot of money, and that's like one time. It's not going to be that much,
But that's everything.
Every single.
That's not like.
That's
everything
you could think of. Like it's a big, huge baseline, and then you could, after that, just check what you need to check. So I think my first point is people are investing in their insurance, and they're trying to utilize that.
Right.
But honestly, the insurance nowadays is not as good as it used to be anyway. It's a scam.
It doesn't want to pay for
honestly,
anything.
Some of my patients are or not insured at all, I should say, and they're doing fine. Most of the prescriptions if they have to get a prescription at the pharmacy, is reasonable. If you have a hospitalization, which we'll talk about in a second, they break that down, they itemize that for you, and it's a big discount. Don't get me wrong, they're still making money on that, and that's a whole nother subject, but you honestly come out better sometimes without insurance. I would say a lot of times. I didn't know if you wanted to talk about that at all with...
Oh, I can. So your health is an investment. So like really, I don't think of the insurance system as an investment. It's more like security, right?
Yes.
And it's like, okay, if I have this big thing happen, I'm going to be covered, but I have to pay $20,000 a year plus a $5,000 deductible. So I have to give them $25,000 a year before they ever cover anything.
But there's other things that you can do for catastrophe too.
Yeah. You can do these like Medi-Share type programs and stuff like that. But I think if you can get something like that, and unfortunately, the Affordable Care Act got rid of a lot of those catastrophic plans that you don't have anymore. We need to bring those back. But if in an ideal world, what I would do from an investment standpoint is save as much money, get the highest catastrophic care I could, and do everything I could, and invest my own money in my health, go into a practitioner like you or somebody else that's doing something like, that's doing what you're doing, taking my own health in my own hands and truly trying to understand and being healthy, exercise and doing everything that I possibly have control over. And that's what I try to preach to people is you're in control. That's the investment, is to take control of your health. It's your responsibility. Don't wait for a doctor in the insurance system to take care of it when you have a real problem.
You'll just be a part of the system.
You need to, yes, you're just in the system.
You're in the wagon wheel, you're at the cardiology office, you're
right.
at the kidney doctor, you're at the endocrinologist, you're at the rheumatologist, you're at every specialty that you could be, because they want to put everything in a box. And then your PCP is like your quarterback. They're basically like just rounding everything up, and they're seeing you and they're just checking the boxes. And I'm not saying that the provider's not trying to do a good job, but they're very limited, especially if they have to see 20 plus patients a day. I'm telling you right now, you can't care for 20 patients a day effectively for preventative.
Not really get to know the patient.
Yeah, not really. Unless you're just not charting anything, and you can't possibly remember, hundreds of people.
Right.
You can't remember. You have to chart. You have to remember what you've got to have a game plan.
Right.
So
you have to know the patient. I think that's what I appreciate about what you do, and I wish more. I think there are some more. It requires less profitability, to be honest. So when people say, "Well, how is it expensive?" I was like, "Well, it's not free. You have to pay for it because you're not billing insurance, and people like you, concierge medicine. The reason it exists is because people aren't getting the answers and the care that they seek.
We're not expensive.
No, we're not expensive.
Somebody's going to say that we are.
If you're trying to use your insurance because you're already paying for insurance, you're going to think it's expensive.
In Dallas, North Carolina, are not expensive.
Right.
But everybody's expensive is different, and
right.
You're always going to spend money on
if
you want to.
If you can't, if you're living paycheck to paycheck and you can't truly afford something, then yes, everything is expensive, right?
And that's different.
But what's also expensive is sitting in the hospital, being sick, feeling bad every day. When you wake up, you feel terrible, and you don't have to. How many people have you helped not feel terrible anymore? That doesn't mean that they feel like they did when they were 20, but they're waking up and they're telling you, man, I got like a new lease on life. My life is completely different. And you love hearing that. I hear that, and it makes me happy to watch and see people actually taking control because somebody is helping guide them. And in the regular system, you're not getting that, right? Nobody's guiding you and giving you a game plan.
Right.
And you have to have the right plan in place to actually do something. I think a lot of people get confused. So the investment is, pay the money to somebody that knows what they're doing.
Yeah, it doesn't have to be me. There are other people like me in other cities around. And
yes, there are some good ones.
You just have to find someone who you feel you connect with, and they're going to, check all the things that need to be checked and spend time with you and listen to you, because it's not cookie cutter and one size does not fit all. And what you think works for one patient, it may not work for the next. And so somebody that has experience in that, and there's no experience like just doing it. I'm telling you, so you have to have somebody who's living and breathing this stuff.
Right. I think another way I characterize it is, that's the direction I think of where medicine is heading. And it needs to head that way, away from the insurance-based system where people can have options where they're getting that care, but you're going to have to pay out of pocket for it. So you need to think of it like a cable bill. If I got to pay $150 a month or whatever it is,
and we're not that.
We're not quite, but a lot. Well, it's varying degrees. Some places might be on the order. I mean, it's not like Planet Fitness, okay? It's not going to be $20 a month. I'm sorry.
No.
It's going to be $100 a month. It's going to be, some places might be $300 a month.
Right.
In Charlotte, other big cities, like people, it's like med spas are trying to do this too, and they're going to charge you a lot. You just got to find the right place. Now, it could all be good, What the whole point is, you got to find somebody that you trust, like you said, that's going to help you and work with you, be with you through that.
Oh yeah, and if they don't know, they've got to point you in the way,
Right.
of where to go. Like they should be guiding you.
Like you
I'm not a specialist, right? Like I'm not a cardiologist, I'm not a rheumatologist, but
yeah, but that's an acute issue a lot of times.
I can handle a lot of things, but I usually can avoid a lot of those specialties. So if a person has a specialist, they can keep going, certainly. And there's times where I need the specialist, right?
Sure.
I do. I send referrals all the time, but it's not anything that I can't manage once they get that, something. Sometimes I just need confirmation of a few things.
Yeah, sometimes you have preventative medicine, everything that you can do from a preventative standpoint.
But I have patients that don't have an issue.
But that's an acute issue, and you have to refer that out to somebody that's specialized. I'm having this heart murmur. Oh, well, we need to send you to somebody that actually is specialized in that, that has the right equipment to assess that. So that still exists, but that's an acute problem.
Right.
So when I'm talking about the investment in your preventative care, to put your body in the best situation where you hopefully don't have those issues, where you need to go see the specialist.
Just remember, when you're spending your money and you're doing your bills and you're paying for Netflix or Disney and you're paying your car payment or whatever it is that you're choosing to do, don't forget your health.
Don't forget your health.
Like, if you are not healthy to be able to enjoy your life, have a good quality of life, then, all of that investing in other stuff, like you said, like a lot of people retire, late 50s, early 60s, and sometimes they drop dead within 2 years. And it's like, wow, they didn't get it. So make sure that you're taking care of yourself now. So, because if you take care of yourself, you can better take care of your family and all that. You'll enjoy your life better. And then later on down the road, when you actually are maybe able to do something with the money that you'll be healthy enough to enjoy.
And it's not just 20 years from now. So like if you invest in your health now, just go back to the example, people who have started with you and they start losing some weight and they're eating better, they're getting a little bit of exercise, and all of a sudden they have more energy. They're waking up, they're happy to get up, they're happier. Well, now you've got the immediate benefit. You're getting a dividend now as an investment. Like you're getting a payoff right now from that investment, because now I feel good, and now I'm waking up and I get going. We're going to go do this thing. I want to go
so it's
do
not
this
just
thing.
For later, it's for now.
It's for now because I feel good now. Well, what's better than that? That makes you a better mom, a better dad, a better employee, a better business owner. Gosh, we own a couple businesses. And we deal with a lot of people, and I can't imagine being tired all the time.
No.
I would not be able to run my business. I would not be able to do anything. I wouldn't be able to do it. And then if I was working 40 hours a week at somebody else's as an employee, like I was in the past, I wouldn't be a good employee. I'd be like this at my desk.
Yes, I guess don't just think about it for your future, then think about it.
But what good is $1 million in your 401k if you don't make it to when you can take it out?
Yeah.
Right? Yeah, maybe your family gets it, and that's great.
Yeah.
But what about your Social Security? You got all this Social Security that you can't use, and guess what? Because Social Security is also a scam. And when you pass away, your heirs don't get it. The government gets to keep all the money you gave them. Thank you for your donation. So if you want to stick it to the government, federal, make sure you live past 65, so they have to pay out your Social Security. And now they're going to get mad at me because I'm going to make Social Security insolvent because people are going to live to 90 now. I apologize for that, CIA. Anyway.
Well, let's wrap this one up.
Yeah, we're going to wrap this up before I go down a rabbit hole.
Yeah.
But
what do you want to say?
Just take your health seriously. Reassess what you spend your money on. I'm not judging you for what you spend your money on. I spend money on all useless things.
Useless.
But you know, I probably buy too many supplements that I'm gonna test this out. You know, but like, you know, I got a couple subscriptions I'm sure that we don't watch. I think we have
Oh,
like
God, we hardly watch TV.
Stars or Paramount that I've, you know, $15 here, $15 there. You know, go through there and reassess, cancel those. Don't cancel your gym membership. Keep your Goins Strong Fitness gym membership. You need that. That's a perfect investment. But if you can eliminate, you know, you eliminate all those little things that you're spending money on, now you have the money to go see a specialist or somebody that's doing what Jessica's doing, get your hormones checked, especially if you're in that menopause age.
Yes, but please don't loop me into just hormones.
Hormones, whole body optimization.
I optimize the whole person, whether you need hormones or not.
Well, right. The whole body optimization doesn't mean hormone replacement. It's optimization of your body. Anyway, we're not going down that rabbit hole. The point is, just take your health seriously. It is an investment. Make sure that you're spending as much time putting effort into your health as you are putting money into your 401k. I think that's the bottom line.
Okay.
Yeah.
All right, that's it. So we will see you in the next one.
Sweet.